Good day, everyone. Today we will focus on a critical topic in tropical medicine and nursing care: dengue hemorrhagic fever. In this lecture, we will explore the following areas: understanding dengue hemorrhagic fever etiology, pathophysiology and stages, clinical management, nursing assessment, care management, prevention, and education. Let's begin. Dengue hemorrhagic fever is a severe form of dengue caused by the dengue virus and transmitted by Aedes mosquitoes. It is a leading cause of hospitalization and death in many tropical and subtropical regions. Pathophysiology. DHF has 4 stages: febrile phase, high fever, headache, joint pain; critical phase, plasma leakage leading to shock; convalescent phase, recovery. Warning signs: abdominal pain, persistent vomiting, bleeding, drop temperature, respiratory distress, hypotension. How to recognize DHF? Monitor for warning signs. Look for petechia ecchymosis and mucosal bleeding. Assess for a rapid drop in platelet count. Okay, let's discuss clinical manifestations of DHF. Symptoms, which usually begin 4 to 6 days after infection and may last to up to 10 days, include high fever, sudden occurs as a result of the infection; severe headaches. Severe headaches also torment the patient. Damage to lymph and blood vessels. As the virus slowly spreads, even the lymph and blood vessels are affected. Bleeding. Bleeding from the nose and gums is a characteristic of DHF. Enlargement of the liver. The dengue virus could also penetrate the liver, causing fatal damage. Circulatory system failure. The circulatory system ultimately fails eventually if the disease is not treated promptly. Medical management. The management of DHF is actually simple as long as it is detected early. Oral rehydration therapy. Oral rehydration therapy is recommended for patients with moderate dehydration caused by high fever and vomiting. IV fluids. IVF administration is indicated for patients with dehydration. For blood transfusion and blood products. Patients with internal or gastrointestinal bleeding may require transfusion, and patients with coagulopathy may require fresh frozen plasma. Oral fluids. Increase in oral fluids is also helpful. Avoid aspirins. Aspirin can thin the blood. Warn patients to avoid aspirins and other NSAIDs as they increase the risk for hemorrhage. Nursing management. Nursing management of patients with DHF is essential in achieving complete recovery. Nursing assessment of a patient with DHF should include evaluation of the patient's heart rate, temperature, and blood pressure, evaluation of capillary refill, skin color, and pulse pressure, assessment of evidence of bleeding in the skin and other sites, assessment of increased capillary permeability, measurement and assessment of the urine output. Nursing diagnosis. Based on the assessment data, the major nursing diagnoses for a patient with DHF are: risk for bleeding related to possible impaired liver function, deficient fluid volume related to vascular leakage, pain related to abdominal pain and severe headaches, risk for ineffective tissue perfusion related to failure of the circulatory system, risk for shock related to dysfunction in the circulatory system. Nursing care planning and goals. The goals in a patient with DHF are: be free of signs of bleeding, display laboratory results within normal range for individuals, maintain fluid volume at a functional level, report pain is relieved or controlled, follow prescribed pharmacologic regimen, demonstrate adequate tissue perfusion, display hemodynamic stability, be afebrile and free from other signs of infection. Nursing interventions. Nursing interventions appropriate for a patient with DHF include blood pressure monitoring. Measure blood pressure as indicated. Monitoring pain. Note client report of pain in specific areas, whether pain is increasing, diffused, or localized. Vascular access. Maintain patency of vascular access for fluid administration or blood replacement as indicated. Medication regimen. There must be a periodic review of the medication regimen of the client to identify medications that might exacerbate bleeding problems Fluid replacement. Establish 24-hour fluid replacement needs. Managing nosebleeds. Elevate position of the patient and apply ice bag to the bridge of the nose and to the forehead. Trendelenburg position. Place the patient in Trendelenburg position to restore blood volume to the head. Evaluation. A successful nursing care plan has achieved the following: absence of signs of bleeding, displayed laboratory results within normal range for individuals, maintained fluid volume at a functional level, reported pain is relieved or controlled, followed prescribed pharmacologic regimen, demonstrated adequate tissue perfusion, displayed hemodynamic stability, a febrile and free from other signs of infection. For prevention. There are many ways to prevent dengue fever, but there are no vaccines available yet. Avoid crowded places. Stay away from heavily populated residential areas. Mosquito repellents. Use mosquito repellents that are mild for the skin, even indoors. Proper clothing. When outdoors, wear long-sleeve shirts and long pants tucked into socks. Mosquito-free environment. Make sure window and ductor screens are secure and free of holes, or use mosquito nets. Stagnant water. Empty your cover bottles, cans, and any containers with stagnant water, as these can become breeding places of mosquitoes. Discharge and home care guidelines. A patient with DHF discharged from the healthcare facility should be instructed to avoid diuretics, avoid caffeine and alcohol as indicated to reduce effects of diuresis. Follow-up appointments. Comply with the recommended medical and laboratory follow-ups. Oral care. Recommend use of soft toothbrush to reduce risk of injury to the oral mucosa. Diet. Foods rich in vitamin K should be recommended to promote blood clotting. Education. Educate patient on the use of mosquito nets and insecticides.